Hello, I am Paolo Constantin and I will talk about the treatment for chlamydia infection, doxycycline versus azithromycin. Now, first of all, chlamydia trachomatis is the most common cause of STD that man can cure. In males, it produces urethritis, while in females, it produces endocervitis. Most women are asymptomatic or have minimal symptoms. It it increases the risk of transmissions of HIVs, and it is a risk factor for cervical carcinoma, so early diagnosis and treatment is required to prevent further transmission. Here's a little video.
Chlamydia is one of the most common sexually transmitted infections. It is a bacterial infection, and as such, it is completely curable. The part about chlamydia that can be disconcerting, however, is that it's usually in women has no symptoms, and so it's very hard to know that you have it. Men will sometimes have a discharge or a burning upon urination. When women do have symptoms, that's often the symptoms as well, when they burning upon urination or discomfort around sexual penetration. Chlamydia is completely curable with antibiotics. It's important that if you are infected, chances are your partner is infected, so that both of you, or how many partners you may have who are infected, that it's important that all of you are treated at the same time so that you don't keep reinfecting one another. With antibiotics, it's really important that you take the full course of antibiotics. If you stop too early, often the infection can reoccur. So you want to finish every antibiotic you've been given. And usually, treatment with antibiotic will cure the chlamydia. One important thing to note is that although chlamydia is completely curable with antibiotics, if left untreated, it can lead to infertility in both men and women. People who are infected with chlamydia are often co-infected with gonorrhea, so often they'll test for gonorrhea if they suspect you have chlamydia, and they'll treat you for both. Usually it's the same antibiotic that will cure both chlamydia and gonorrhea. You're not automatically tested for chlamydia if you go for an annual pelvic exam or you go to the doctor, so if you suspect that you might be infected, or if you know your partner is infected, you actually have to ask to be tested for it, and the way they test is through a urine test or a swab test, and you can usually get the results right there. Once they know what you have, they'll know what to prescribe, and then you can cure yourself of chlamydia.
Okay, so the treatment is azithromycin 1 gram or doxycycline 100 milligrams, which are effective against C. trachomatis. Evidence of multi-drug resistance to C. trachomatis are presented in women with high bacterial load. In a closed population receiving the treatment for urogenital chlamydia infection, the results were the following. Azithromycin 97% effective, while doxycycline is 100% effective. Here's another video.
Chlamydia is very common. It's one of the most common STDs, and there are about an estimated 3 million cases in the United States per year. Chlamydia is a disease that can cause inflammation in men, the urethra, and in women, they are most commonly are asymptomatic 60% of the time, but if they do have symptoms, they may come in complaining of vaginal discharge or vaginal odor. They may have vaginal spotting, or they may even have pain or burning when they urinate. Men, when they come in with complaints, they will commonly complain of a urethral or penile discharge or a drip. They may also complain of a little tingling or irritation or burning when they urinate. Chlamydia is transmitted through sex, whether it's vaginal sex, where it's penis to vagina, or whether it's oral sex, where the mouth goes on the penis, or whether it's anal sex, where there is anal receptive sex, where the penis goes in the anus. The test for chlamydia involves a urine-based test where the patient would urinate in the cup and the specimen is sent to a lab and tested for chlamydia, and the results come back within 3 days. Chlamydia is easily treated with a low-cost antibiotic that cures the disease and kills the organism when you take it. Some of the complications of chlamydia, if it goes untreated in women, it can lead to infertility, as well as it can lead to pelvic inflammatory disease. In men, if it goes untreated, it can lead to pain in the testes, and those are some of the more common complications that can occur in both women and men. If you're going to have sex, then you need to use protection, but to be completely free of chlamydia is not to have sex. Those people who should be tested for chlamydia include women who are sexually active under the age of 25 should receive an annual test for chlamydia, and then those women who are sexually active who are over the age of 25 and have risk factors for chlamydia, which include multiple sexual partners and unprotected sex. Those men who should get tested include, of course, if they have symptoms like a discharge, and if they and consider getting the test annually if they're sexually active without symptoms.
Okay, so this STD can be cured with a simple round of antibiotics most of the time. In a study made with 567 participants, 284 were assigned to receive azithromycin and 283 were assigned to receive doxycycline. There were no treatment failures with doxycycline. However, there were 5 treatment failures with azithromycin. Here are 2 videos I would like to show you.
At first, chlamydia's elementary body invades a cell by forming a pit on the cell's surface. Enclosed within a pinched-off piece of the cell's outer membrane, known as the entry vacuole, elementary bodies begin differentiating into non-infectious reticulate bodies. The bacteria then thrive by extracting nutrients from the host cell's cytoplasm. Usually within the cell, lysosome fuses with entry vacuoles harboring foreign intruders. But because of a needle-like projection called a type 3 secretion apparatus, the bacteria may inject some of their own proteins into the outer membrane of the entry vacuole. These proteins physically block the lysosome's assault.
Forbidden donut. Don't! Don't! Don't!
Chlamydia can also hide from lysosomes by refurbishing their entry vacuole with molecules they divert from the host cell's lipid distribution center, otherwise known as the Golgi apparatus. These stolen lipids make the vacuole virtually indistinguishable from the cell's own organelles.
Well, howdy doodly do.
Buenos ding dong diddly dia, senor.
And this is why chlamydia is so hard to stop. From there on, new elementary bodies break out of the host cell within 72 hours after the initial invasion, possibly triggering apoptosis or suicide of the host cell. Now they can go on to infect more and more cells.
Dr. Bobby Lazara, and the doctor is in. Today's topic, chlamydia. Chlamydia? What is chlamydia? Chlamydia is the most common sexually transmitted disease caused by bacteria. Bacteria? It's called chlamydia. Why is it important? It's important because left untreated in women, it can lead to significant problems. Pelvic inflammatory disease, an infection involving the female reproductive organs, also referred to as PID. As a result of that, there can be scarring of the reproductive organs. The resultant pregnancies that may occur could be ectopic, that is, occurring outside of the womb. This is very dangerous. Therefore, chlamydia needs to be treated. What are the symptoms of chlamydia? It can be very, very, very silent. Symptoms may be minimal. In women, there may be some vaginal discharge, there may be some pain on urination, perhaps pain on intercourse. In men, there may be some discharge from the penis, or there may be some pain on urination. Sometimes there may be no symptoms at all. Who's at risk for chlamydia? Any sexually active adult, particularly young patients. Therefore, the recommendation is that women should be screened for chlamydia if they are young and sexually active. The diagnosis can be made by your doctor utilizing a variety of tests. Very simple. What's important is that chlamydia can be treated, can be eradicated with antibiotics prescribed by your doctor. Today's topic, chlamydia. I'm Dr. Bobby Lazara, and the doctor is in.
Okay, so here in Ecuador, the first study was published in 1995 with 50% of the subjects being FSWs. The study was made first in 1986 with over 300 individuals. The prevalence was of 53.4% of FSDs and 34.5 partners and 1.6 pregnant women. Here's another video.
Chlamydia is one of the common sexually transmitted diseases that is caused due to infection with the bacterium Chlamydia trachomatis. Chlamydia is among the most common STDs in the USA. According to estimates by the CDC, Center for Disease Control, it affects 2.8 million people in America each year. Chlamydia may be transmitted via oral, anal, or vaginal sex. It may also be transmitted from a female who is infected with the disease to her infant during childbirth. Any person who is sexually active can get infected with the bacterium. The risk of infection increases with the total number of partners you have sex with. Symptoms of chlamydia. Around 75% of females and 50% of males who are infected do not show any symptoms and signs. If symptoms do occur, they appear within 1 to 3 weeks post-exposure to the bacteria. Females develop abnormal discharge from vagina or burning during urination. In case the infection reaches the fallopian tubes, some females may present with symptoms of pain in low back, pain in lower abdomen, fever, nausea, pain at the time of sexual intercourse and bleeding between menses. Symptoms in males are pain and swelling in testicles, pain in lower abdomen, burning during urination, green or yellow discharge from penis. Subscribe us to know more health tips and home remedies.
So in conclusion, both antibiotics have high efficiency. However, none of the treatment has notable superiority over the other one. So here's my last video.
Chlamydia is a very common sexually transmitted infection all over the world. In fact, chlamydia is the most common STI in Australia. Chlamydia is caused by the bacteria Chlamydia trachomatis. Chlamydia is passed from one person to another during sex. This includes oral, anal, and vaginal sex. Chlamydia can affect all people regardless of their sexuality, but is most common in young people. The majority of women with chlamydia infection have no symptoms at all. And the majority of men with chlamydia infection have no symptoms. Unfortunately, this makes it easy for an infected person to pass on chlamydia to their sexual partner without even knowing it.